Assalamualaikum warahmatullahi wabarakatuh and very good morning. I'm Dr. Doni Sonjaya. I'm a master student from University Science Islam Malaysia. I would like to present my poster with the title Age Estimation of Adult Malaysian from Premolars on Dental Panoramic Tomographs using the Gustafson'S method. As we know, age is one of the important factors in establishing the identity of the person, apart from sex, ancestry, and stature. Age estimations plays an important role in every aspect of human life, including forensic medicine, clinical dentistry, and archaeology. Age estimation is critical, especially in dealing with medico-legal cases, in identifying deceased victims, crimes, and accidents. So, several methods available for determination of age. One of them, Gustafson, he in 1950 developed a method assessing the age of an individual from a tooth. He found there are 6 biological changes from the tooth. He found 6 criteria related with the age. So the criteria number 1 is secondary dentin formation. Criteria number 2, cementum apposition. Criteria number 3, root resorption. Number 4, attrition. Number 5, periodontal recession. And number 6, transparency of the root. So I use these criteria in my project. These are the objectives for my study: to estimate the age of Malaysian adults by using Gustafson criteria on dental panoramic tomographs or DPT, and then to produce regression equations for age estimation of Malaysian adults using Gustafson criteria on DPT. And the last, to determine if there are differences of age estimation between premolars on different sides of the lower arch. This is my methodology for the project. So I have 400 sets of DPT or dental panoramic tomograph. So if the patient has sound lower premolars, he or she Malaysian, and age 18 years and above, I will include in this project. Then I check the 4 Gustafson criteria, which are secondary dentin formation, periodontal recession, cementum apposition, and attrition of the lower premolars. Why I choose the 4 criteria from Gustafson? Because from the previous study show that only these 4 criteria can be evaluated, can be analyzed with radiograph. Then I classify the sample based on the age group from group 1, which is 18 years old to 29 years old, up to group 5, 60 years old and above. And I classify based on the gender. So I evaluate lower premolars, right and left. Total is 4 premolars. Then assess with regard to 4 chosen Gustafson criteria that I mentioned before. And then I evaluate, I analyze according to stage classifications. This is the result. In this project, 4 sets of equations were formed for age estimation for each right and left mandibular premolar tooth. If we look at here, the result obtained from the four criteria Gustafson was highly correlated with the chronological age, as the value of the correlation coefficient R range from 0.77 to 0.79. Hence, the regression equation calculated in this project can be recommended in principle for the adult age estimation of Malaysian individual. However, the tooth left second premolar has the highest R value. Therefore, this tooth must be the preferred tooth of choice in age estimation. The next table we can see here is a comparison between right and left premolars. So pair t-test was done to evaluate the mean values on each variable in the same subject. The result revealed from the 8 pairs that there was a significant difference between right and left premolar teeth on characteristic secondary dentine formation for first premolar, and then characteristic cementum apposition for first premolar and second premolar, and also for characteristic periodontal recession for tooth second premolar. If we see here the p value less than 0.05. So discussion. Gustafson method, which focuses on 6 regressive changes, has been modified and evaluated in several studies of extracted teeth and radiographs. I use lower premolars in this subject because these teeth are clear of the projection of the spinal column found on the anterior tooth area expected for dental panoramic tomograph or DPT. Gustafson criteria of secondary dentine formation, periodontal recession, attrition, and cementum apposition used on dental panoramic tomograph yielded very good correlation with chronological age. Just now we found that R values ranging from 0.77 to 0.79. If we compare with the previous study, this value slightly higher than those by Olzer when they did in 2012, but concur with Timmy et al. When they did in 2016 for the German people. So conclusion, I can conclude that the Gustafson criteria applied on DPT can be used for forensic age determination in Malaysian adults aged 18 years and above. The result in terms of good R values indicate that Gustafson criteria applied on DPT has very good potential forensic, clinical, and archaeological applications, especially as this is a non-invasive procedure for age estimation in human adults. Age estimation in human is a comprehensive effort, consequently needs considerable experience in recognizing significant changes and allowing for the ability to notice variability within any particular population. Result from this study shows that the 4 characteristics found by Gustafson have strong correlation with chronological age. In addition, This research may be useful for validation and comparison with other similar Mongoloid populations studies in the future. With that, I end the presentation. Thank you very much. Wassalamu alaikum warahmatullahi wabarakatuh.